Welcome and thank you all for being here today. We're pleased today to kick off the National Children's Study, which is a federal study being implemented locally by the Children's Hospital of Philadelphia. The study will examine the effects of the environment on children's health. It will look at important issues such as asthma, allergy, obesity, to try to determine the role of the environment and genetics. As one of the first counties to be selected, we're thrilled to be partnered with Children's Hospital of Philadelphia, which is the premier children's hospital in America.
If you want to understand why the study is so important, there are a few things I think you should know. Increasing rates of autism spectrum disorder and attentional deficit disorder portend serious changes in the landscape of childhood development in the United States. Some studies suggest that the rate of autism spectrum disorders have increased by as much as 370% from 1980. Attention deficit disorder has increased by approximately 250% from 1990. Asthma rates among U.S. children remain at historic highs, and childhood obesity has tripled from about 5% in 1980 to over 15% currently. The study's scope is unprecedented, and so is its potential. The study will follow 100,000 U.S. children from before birth through their 21st year of life. The study will examine how a child's environment interacts with their genes to produce risk of these pediatric morbidities. The study will look at everything from the air children breathe, the food they consume, the amount of physical activity they have, to the neighborhoods that they live in. We feel certain that the knowledge we gain from the study will lead to the development of new prevention strategies and will benefit our children's health, and our nation's healthcare costs will be reduced. Like past studies that led to the development of life-saving strategies to prevent heart disease, sudden infant death syndrome, and birth defects, the National Children's Study will change our child's health for the better.
The benefits, not just to Montgomery County, but to all of us, in learning more about the medical challenges that our children face, will allow us to, as part of the county, to make a very big contribution to a healthier future for our children.
This is a proud moment for Montgomery County. Joe and I spoke about this on the way over. The fact that we don't have to wait 21 years to get results is important to us, but we want to be able to act on things as soon as they become available.
The effects of this study will be felt for generations to come. The years of research ahead will yield valuable data for helping children live healthier lives. And this ambitious study has the amazing potential to uncover clues for improving treatment and curing debilitating and sometimes deadly health conditions. Thank you.
The National Children's Study is a cost-effective, scientifically sound research program that will enhance our understanding of factors affecting children's health and development. I am pleased to help launch the National Children's Study in Montgomery County, and I encourage families in our area to participate proudly. Sincerely, Allison Y. Schwartz, Member of Congress.
Our investigators will be able to access samples that Dr. Culhane and her team will collect, and we will learn even greater things about childhood diseases, and we'll be able to use this to create new therapies and new ways to prevent disease. I'd rather prevent disease than treat it. I would like to thank the federal officials representing Montgomery County who helped make the NCS possible, in particular Senator Specter, Senator Casey, Congresswoman Schwartz, who you just heard from, and Congressman Gerlach. This strong commitment to child health and wellness has been integral to the launch of this study. And I'd like to thank all of you for being here to help us celebrate this. The National Children's Study really has the potential to transform the world of health care for children. So thank you.